بسم الله الرحمن الرحيم. أبنائي الطلبة، أهلا وسهلا فيكم في محاضراتنا اللي هتبدأ لكم من خلال this e-learning، التعلم عن البعد بسبب الظروف الراهنة. المحاضرة هذه هنتكلم فيها عن anatomy of the heart valves. إحنا في محاضراتنا السابقة كنا تكلمنا على regional anatomy and relations of the heart or location of the heart in the mediastinum with its pericardium and the big structures coming and going to the heart. اتكلمنا برضو إحنا على the structures of the heart، بمعنى there are two atria and two ventricles، واتكلمنا عليهم بالتفصيل تماما. اتكلمنا على relations of the heart، surfaces of the heart، اتكلمنا على borders of the heart، اتكلمنا على base of the heart، اتكلمنا على apex of the heart and their clinical implication. كل جزء من الاناتومي اتكلمنا على its clinical on correlations اللي بنقابله في حياتنا العملية. Heart valves, most of you I think did know that the heart is having four valves. Two valves between the atria, the right atrium and the left atrium, and those valves are the two major valves in the heart are the two atrioventricular valves, the valve between the right atrium and the right ventricle, which is the tricuspid valve, and the valve between the left atrium and left ventricle, which is the bicuspid or mitral valve. Then the other type of valves which are in the heart are the semilunar valves, which are guarding the inlet to the big structures, mainly the aorta and the pulmonary vein or pulmonary trunk. The valve between the left ventricle and the aorta is called the aortic valve. The valve between the pulmonary trunk and the right ventricle is the pulmonary valve. Atrioventricular valves lie between the atria and the ventricles. AV valves prevent backflow of blood into the atria when ventricles contract. Chordae tendineae, which we'll see in the anatomical illustrations coming in the next slides, those are anchoring the AV valves to the papillary muscles, which are projections from the inside of the musculature of the cardiac muscle of the ventricular walls, and those, the main function for them is to prevent the prolapse of the valve into the atria. Atrioventricular valves, we could see in these nice illustrations, really looking at this picture. This is the anterior aspect. This is the posterior. Here is the right, and this is the left. You know, most anteriorly, how those valves being arranged in our body, in our heart, I mean, we are having anteriorly mainly is the pulmonary, the most anterior valve, big valve, is the pulmonary valve. Coming just posterior to it is the aortic valve. Coming just to the left is the mitral or bicuspid valve. Then to the right side, we are having the tricuspid valve. The atria and ventricles are separated into two functional units. Functional, a little bit kifad, which is the atria, and a little bit lower down, generally speaking, I mean, total, I mean, are the ventricles, and those are being separated by a fibrous skeleton, which this fibrous skeleton of the heart is having a fairly critical and very important function, completely concerning the fixity of the valves and the conductivity of the conducting system of the heart, in addition giving origin to the something like fibrous string fixing the valves in their position during contractions, during diastole and systole of the heart. The semilunar valves more or less having an attachment to that fibrous skeleton still, but their main functions are when the ventricles are pumping the blood to the aorta through the semilunar valve, aortic semilunar valve on the left side, and to the pulmonary semilunar valve on the right side, they will be opened. And during diastole, they will be opened so as to let the blood coming from the atria to the ventricles and so on during systole and diastole. The two types of the atrioventricular valve is to start with, let us start with the tricuspid valve, which is having a three flap structures. And the tricuspid valve, as we mentioned before, it lies between the right atrium and the right ventricle. Coming to the bicuspid valve, which is having two flaps. It's an atrioventricular valve between the left atrium and the left ventricle. The atrioventricular valves allow blood to flow from the atria to the ventricle, but normally, it prevents the backflow of blood. Opening and the closing of the valves occur due to relative pressure. If the pressure is higher a little bit in the atria, they will be open so as to push the blood from the atria to the ventricle, and vice versa. When it is being, during systole, when the blood will be ejected or pumped to the pulmonary trunk and the aorta, they will be closed to prevent the backflow of the blood to the atria. This a closing of the atrioventricular valve having a clinical implication, which is giving the first heart sound, which is being composed of two components. The first component is uh, mitral valve closure, followed by the tricuspid closure, and it is assembled by the word lub, in contrast to the lub dub, which is during the diastole, the closure of the semilunar valves. We shall explain it in. Concerning the dynamics of the atrioventricular valve, it's nice to understand. As we mentioned before, according to the relative pressure in each of the chambers of the heart, I mean in the atria, if the pressure in the atria is coming high so as to push blood from the atrium to the ventricles, those valves will be open to let the blood come through, say, through the mitral valve or the tricuspid valve. This is drawing diagrammatic representation of say the left ventricle. Here the papillary muscles, chordae tendineae, and here the AV valve being opened, allowing the blood to go from the atrium to the ventricle being opened. But during systole, here is the papillary muscles will be contracting through the chordae tendineae with the fibrous ring or annulus of each atrioventricular valve, and this causes a closure of the AV valve while the blood being ejected to the aorta or the pulmonary trunk. And here this first heart sound is coming, a closure of the AV valves. Let us look at this diagrammatic representation really through a longitudinal section of the heart. Coming to this is the right side of the heart. This is the right ventricle with three cups in it, three cups of the atrioventricular valve on the right side, And those three cups are connected by tendinoculi. Those are the tendinoculi through the papillary muscles. And the papillary muscles here are composed of posterior papillary muscle, anterior papillary muscle, and here is the septal papillary muscle. These are very important function preventing the prolapse of the valves of the atrioventricular valves to the to the atria during contraction of the heart and pushing the blood there to the aorta and pulmonary trunk, which is a vital function of the heart through valves. There is something called the tricuspid valve complex, and this complex is composed of, so as to have a complete picture about how the valve is being functioning and fixed in position in a way and doing its function in a fairly rhythmic, regular way. And it is composed mainly of a tricuspid valve annulus, and it is fixed for we call it as a skeleton of the heart. This is a fibrous ring, really, like a bone. I don't like say bone, but this is a skeleton of the heart and is strongly attached to the cardiac muscles around, giving us the tricuspid valve annulus. Then the tricuspid leaflets of the valve itself, those the septal, the anterior and posterior, coming to the tendinoculi, attaching to the papillary muscles, and coming here the right ventricular papillary muscles, which are the three ones. Septal papillary muscle, anterior papillary muscle, and coming to the posterior papillary muscle, and the right ventricle itself. It is very nicely illustrated in this diagram, really, on our right side. This is the right, the papillary muscle, posterior or inferior, let me call it. The coming here, the chorditendini, three of them. This is the septal, this is the anterior, and this is the posterior or inferior one. And here the interventricular septum coming to the cavity of the left ventricle here, which is guarded by still the atrioventricular valve called the mitral valve and the aortic valve, semilunar valve on systole. I elected just to show this echocardiogram picture, which is a very nice illustrations of the papillary muscles. This is the anterior papillary muscle. This is the posterior papillary muscle. This is septal papillary muscle. Those, if we can get them or diagnose them clinically by an ultrasound machine, which is called an echocardiogram, it means a very good clinical implication because one of those septal muscles or papillary muscles, I mean, it could be disrupted. On that basis, there will be some clinical manifestations and the symptoms of the patient could be understood correctly. By the way, by echocardiogram, we can see the closures and opening of the atrioventricular valves and other valves, really. So we can illustrate any disease, any thickening, any relapse, any prolapse, any infections, any granules forming over the leaflets of the valve could be diagnosed and see, and on that basis we can reach a proper diagnosis to the patient. Tricuspid valve, let us have the tricuspid valve to start with. As we know here, let us look at the topmost picture. Here is the pulmonary. Here we have the aortic valve. Here is with the yellow arrow is the tricuspid valve. It guards the atrioventricular orifice between the right atrium and ventricle. It has three cups really. One anterior here, one anterior, one posterior, and one septal, as we illustrated there in the atrioventricular valve explanation. And those leaflets are attached, as we said, by the chorditendini in here to the papillary muscles. It's a complex of as we explained in the tricuspid complex, really. The bases of the cusps, the bases of the cups are attached to this skeleton, which is the greenish one. I can show it in here. The green skeleton, it's like a bone. It's very strong. It makes a competent and perfect fixation of the valve in its position. base of the cusp are attached to the fibrous ring of the skeleton of the heart, whereas their free ends of the ventricular surfaces are attached to the cardiotendinei. Cardiotendinei fibrous structures connect to the cusp, connecting the cusps to the papillary muscles according to their anatomical location. Look at this nice diagrammatic representation of the tricuspid valve. There is the anterior leaflet of that. There is the posterior one for it, and this is the septal one. Each one, as we see, it is attached to the fibrous ring, chordotendinei, then it's related the papillary muscles. By the way, let us look at the coronary arteries. You know, here is there is the aorta coming from the left ventricle. This is the aortic sinus in here, and giving the right coronary artery. It's a nice picture just to see. Here on the left side, we are having the left coronary artery, and here we are having the coronary sinus, the drainage of the. Just have a look on it to us to discuss later on in the coming slide. The mitral valve, by the way, the word mitral, I elected just to give explanation. It's the bicuspid valve. And the word mitral comes from the word meter. It is the bishop's hat. It's the bishop's which is having an anterior and posterior. It's like a bishop's hat. It's not the Catholic Church. Just to keep this picture in mind, it will lead us just to remember the structure of this valve. The mitral valve guards the left atrioventricular orifice that prevents backflow of blood to the left atrium. This is the one bicuspid valve. The two cups, one anterior and one posterior, and have a structure similar to that of the cusps of the tricuspid. That's to say, there is a ring, there is a leaflet, there is a chordotendinei, there is a papillary muscles, anterior and posterior, according to the relative position for the anterior cusp is larger and intervenes between the atrioventricular valves and the aortic orifice. The attachment of the chordotendinite to the cusps and papillary muscle is similar to that of the tricuspid valve, and its closure is, this is exactly given the first heart sound to start with. We said the first heart sound is composed by closure of the mitral, followed by the tricuspid closure. This is the first, is one, we call it, speaking. Coming to the semilunar valves guarding the exits of the aorta and the pulmonary trunk from the left ventricle and pulmonary trunk, respectively. The aortic semilunar valve lies between the left ventricle and the aorta. The pulmonary semilunar valve lies between the right ventricle and the pulmonary trunk. You know, the reclosure is causing the second heart sound. Closure of the aortic followed by the pulmonary closure, it gives the second heart sound, which is the. So the first heart sound by the closure of the atrioventricular valve giving the lub, and the closure of the semilunar valves giving the dub. So the heart, when we are hearing the heart or auscultating the heart, we are hearing the lub dub, lub dub, lub dub, lub dub, lub dub, and so on. In summary, the heart sounds lub dub due to the closure of the lub, closing of the atrioventricular valve, and the closing of the semilunar valves. The pulmonary valves, they are having a specific characteristics, let me call it. And it guards the opening between the right ventricle and the pulmonary trunk. It consists of three semilunar valves, exactly like this picture, really, formed of folds of endothelium, and in between the folds of endothelium, there is some connective tissue. The cusps, they are curved lower margins, and on each side, curved on each margin, on each side of the cusp, and attached to the atrial wall to prevent the cusps from prolapsing into the ventricle. The opening mouths of the cusps are directed upwards to us to be filled with the blood on a closure. This is very important. Into the pulmonary trunk, where at its roots there are three dilatations called the sinuses, and one is situated external to each other. This is the aortic, the pulmonary sinuses. They are filled with the blood. They are giving the chance for this leaflets to be filled with the blood so as to cause the closure of the valve. There are something characteristic and different from the AV valves on the left side, and those are that's to say there are no chordae tendinae and there are no papillary muscles to be attached to those valves. The three semilunar valves are arranged as one posterior cusp and two anterior, called the anterior and right cusps during the fetal stage of in the embryo status of life. But in the adults, it could be changed. The cusps of the pulmonary and aortic valves are named according to their position in the fetus. In the adults, there will keep some rotation to the left, and the name could be coming as left, right, and anterior leaf cusps of the pulmonary valve. Coming to the aortic valve, look at this again, this picture illustrating one. This is the anterior, this is the lateral, this is the left, and this is the posterior one. Of course, here is the right. The cusps, exactly like the semilunar valve, it has three cusps really. One cusp is the anterior one. This is with a yellow arrow with the right cusp, and two located posteriorly, the left and posterior. This is the left and posterior, and here there is something like called aortic sinuses, and through those aortic sinuses are coming one anterior and giving the right coronary artery. This is the one, and one posterior, and this is giving the left coronary artery. And the origin for this left coronary and right coronary is very important and crucial in the management when we are doing some sort of echocardiography and doing some sort of cardiac catheterizations to see the patency or any pathology in the in symptomatic patients. For the dynamics in semilunar valves, it's nice, this illustrations there. So if this is the aorta coming from the left ventricle, and during ventricular systole, the cusps are pressed against those cusps are pressed against the wall of the pulmonary aortic valve by the outstretching out pushing out pushing or pumping of the blood from the ventricle to the aorta or the pulmonary trunk. But during diastole, blood flows back towards the heart and enters the sinuses from the aorta or the pulmonary trunk, and those cusps will be filled with the blood, occupying a space, causing their closure really. And that closure is causing the second heart sounds, closing the pulmonary and or the aortic really. Just for a clinical ideas in this presentation, as you know, many diseases could affect the heart valves. Namely, in the pediatric age group, we are having the rheumatic heart diseases, rheumatic endocarditis, or valvitis. The valve will be affected. One of those examples like this. This is the original pulmonary valve, a tricuspid valve, and its closure patently and perfectly without being affecting. Blood is not returning back, and it closing perfect. If we are looking for, and this is the bicuspid valve really, just closing in a way without being neither prolapsing nor, and nor thickening or fibrosis of the cusps of the mitral valve. But here, if we are looking to this D structure, there is some swelling, some tumor, still tumors could come to the, yeah, could be benign, could be whatever, but this is the valvular endocarditis in this one, and in the C. Fibro elastoma in the valves themselves could be happening in here. I mean, and this could be diagnosed really by an ultrasound, could be diagnosed by a CT scan or some other specific studies for all of our patients. Uh, Before finishing this presentation, we are to have, just to remind you about what is known as the skeleton of the heart. The skeleton of the heart consists of fibrous ring here, tricuspid, mitral, pulmonary, and aortic around or surrounding them. That surrounds the atrioventricular, pulmonary, aortic valves, and they are continuous. This is the fiber continuous with the membranous upper part of the ventricular septum. And this is very important as if the whole heart is one structure having one skeleton holding it. And the function of this fibrous ring around the structure is to separate, and this is very important really, to separate the muscular walls of the atria from those of the ventricles, separating two functional units, as we said, starting this presentation, but providing an attachment to the muscle fibrous rings to the chordiotendineal, the leaflets or the cusps later on to go to the papillary muscles by the chordiotendineae, on the atrioventricular valves, and just to, or the leaflets of the or the cusps of the semilunar valves. Support the bases of the valve cusps and prevent valve from being stretching. It's not stretchable really, and becoming incompetent if they are opening more, blood could regurge and or stenosed more. The skeleton of the heart forms the basis of electro disconnection between the atria and the ventricle. And this is very important because whenever the atria is contracting, the ventricles are relaxing. And activity of this part or the chamber of the heart could be different from that part. This could be represented by an ECG presentation we will explain later and have clinical implications. So skeleton of the heart is having a very critical function and very important. Any question really, I am waiting to send to me at any time, in a moment. Thank you a lot for listening. خلاص تمام.